Assalamualaikum and a very good day, everyone. My name is Ibrahim, and today I'll be presenting a topic on Down syndrome. Now, going on to the introduction of Down syndrome. So, Down syndrome is a genetic disorder caused when abnormal cell division, which result in an extra full or partial copy of chromosome 21, or also known as trisomy 21. So this extra genetic material causes the developmental changes and also physical features of Down syndrome that we can usually see on people with Down syndrome. And Down syndrome also varies in the severity among individuals, causing a lifelong intellectual disability and also in their developmental delays. So it's most common genetic developmental or chromosomal disorder and can cause learning disabilities in children. And also, it is also commonly causes other medical abnormalities, including heart or gastrointestinal disorder. Now going on to the types of Down syndrome. So on Down syndrome, there are three types of Down syndrome, which is the first one is trisomy 21, mosaic Down syndrome, and also translocation Down syndrome. So for trisomy 21, usually the person has three copies of chromosome 21 instead of the usual two copies in all cell. So this is caused by the abnormal cell division during the development of the sperm cell or the egg cell. So that is for trisomy 21. For mosaic Down syndrome, so in this rare form of Down syndrome, a person usually has only some cell with an extra copy of chromosomes 21. So this mosaic of normal and abnormal cell is caused by abnormal cell division after fertilization. So you have a little bit of different compared to trisomy 21, in which the person only have some cell that contained the three copies of the chromosome 21. And as for translocation Down syndrome, so this type of Down syndrome can also occur when there is a portion of chromosome 21 become attached, or we can say translocate onto another chromosome before or at conception. So these children which have translocation Down syndrome usually have the usual two copies of chromosome 21, but they also have an additional genetic material from chromosome 21 attached to another chromosomes. Okay, now here is the diagram of the type of Down syndrome that you can see. So as you can see here, in every cell, usually all people have the same amount of chromosome, but those with Down syndrome or those with trisomy 21, they will have an extra chromosome number 21, as you can see here, the one that are circled in the picture. So this is when they have an extra chromosome at chromosome number 21, it is classified as trisomy 21 or Down syndrome. Um, but those with trisomy 21 or Down syndrome, they will have an extra chromosome at number 21, chromosome number 21 in all cell. The things that differentiate trisomy 21 to mosaic Down syndrome is that in mosaic Down syndrome, they also will have an extra chromosome in chromosome number 21, but it only happen to some of the cell, not every cell. In trisomy 21, it will happen in every cell. And as last one is the translocation Down syndrome. So in translocation Down syndrome, some parts of the chromosome, the extra chromosome 21, are attached to another chromosome. For example, they are attached to chromosome number 5, number 13, or even number 18. So that's what make it different from one type of Down syndrome to another. So, as mentioned before, under Down syndrome, there are three types that make it different from one to another types. So now going on to the symptoms of Down syndrome. So here are the symptoms in regard of the features of the people with Down syndrome. So as we all know, people with Down syndrome usually have these very typical features that make it very easy to be known by others compared to those normal person that have these special features. And some of people also can see that they have a very similar feature uh, that they share from one another. So, as for the symptom of Down syndrome in their features, usually at birth, babies with Down syndrome usually have a certain characteristic sign, including a flat facial features, a very small head and also ears, a short neck, a bulging tongue, and eyes that slant upward, typically sheep ears and also poor muscle tone. So sometimes they can be seen as very flappy when they're babies. So an infant with Down syndrome also can be born in an average size as normal babies, but usually they will develop more slowly compared to those babies that present without the condition itself. Another symptom of Down syndrome is that people with Down syndrome usually have some degree of developmental delay that include their mental and also social developmental aspect. So, in this issue, usually they have a mild to moderate scale or degree of the delay or disability that they have. And a mental and social development delays also may mean that the child could have or possibly face an issue with their behavior. They might have an impulsive behavior. They might also have a poor judgment, which causing them to have difficulty in making decisions, and also they usually have a very short attention span compared to normal people, and also they might present with slow learning capabilities. Now you already see the symptom of Down syndrome in the aspect of features and also their development. Another symptom of Down syndrome that we can see is in the aspect of medical. So, some medical complications that usually often accompany Down syndrome condition, including congenital heart defects. This is very common, congenital heart defects. They also might have hearing loss, poor vision, cataracts, or also known as clouded eyes, and also hip problems such as dislocation, leukemia, chronic constipation, sleep apnea, or also known as interrupted breathing during sleep. They also might present with dementia, which is a thought and memory problems, hypothyroidism, which is they might have a low thyroid functioning, obesity, late tooth growth, which causes problems in their chewing or feeding, and also they might present with Alzheimer's disease later in their life. So usually people with Down syndrome are also more prone to infection, and they might struggle with respiratory infection, urinary tract infection, and also skin infection That's why people with Down syndrome sometimes are very prone to get ill compared to those with a normal person with a very normal medical functioning, with very good heart functioning. Now that we already know the types and also the symptom of Down syndrome, now we're going to see what is the risk factor of getting Down syndrome. So some parents may have a greater risk of having a baby with Down syndrome if the mother, for example, have an advanced maternal age. So usually a woman's chances of giving birth to a child with Down syndrome increase with age because the older age have greater risk of improper chromosome division. And also a woman risk of conceiving with a child with Down syndrome increases after 35 years of age. However, most children with Down syndrome are born to women under the age of 35 because younger women have far more babies. And then another risk factor that might lead to parent to have a risk of having a baby with Down syndrome is being a carrier of the genetic translocation for Down syndrome. So both men and also women can pass the genetic translocation of Down syndrome on to their child. And the third risk factor of having a baby with Down syndrome is having had one child with Down syndrome. So parents who have one child with that present with Down syndrome and parents who have a translocation themselves are at an increased risk of having a baby or another child with also Down syndrome. So a genetic counselor usually can help them in assessing the risks and also having a second child, having an opinion on how for them to have a second child with Down syndrome. Now going on to the next one, which is how to treat Down syndrome. So unfortunately, there is no cure for Down syndrome up to this date, but there are a wide variety of support and also educational programs that can help both people with the condition and also their family members. So available program usually start with the intervention in infancy, and also in this program usually they focus more on the special education of the child, which lead by special education teachers and also therapists which will help them in learning to enhance or to improve their sensory skills, their social skills, their self-help skills, motor skills, and also in language and cognitive abilities. Usually, therapists also will help them with their behavioral issue if they were present with one, as mentioned before in their symptom or the delay that they might have due to their condition. So before I end with my topic today, I just want to share a little bit more on the life expectancy of the child that born with Down syndrome. So usually back then, people with Down syndrome are thought to live a very short age, but it's very different compared to now. So the lifespans of people with Down syndrome have increased dramatically for people with Down syndrome. So as for today, someone with Down syndrome are expected to live to more than 60 years, but it is depend on their severity of the health problem that they might have. So as you can see here, here are the references that I use for this topic. And that's all from me. Thank you very much.